A second important area that is incentivized is the use of electronic health records. Actually, this provision was not part of the Affordable Care Act. It was actually part of the Recovery Act. It's called High Tech. It provides financial incentives to both doctors and hospitals to install electronic health records, but more importantly, to meaningfully use them. It's one thing to have a computer on the table. It's much more important to have a computer that allows you to improve patient care and to communicate patient results to other providers who are caring for the patient, whether that's another hospital or another doctor. And the basic way to incentivize the adoption was first to provide physicians a financial incentive up to $44,000 through Medicare and $63,000 through Medicaid to adopt electronic health records and use them. Beginning in 2015, then, that was the carrot part of it, but beginning in 2015, the stick part is that physicians who don't show meaningful use of electronic health records will face a penalty. As we can see from this graph, hospital adoption of electronic health records has actually substantially increased. You can see before the Affordable Care Act, it was low, in the low single digits and just above 10, but it's dramatically improved with the financial incentives from the high tech. Now, no one thinks that electronic health records are the be-all and end-all. They're not a panacea, but they are an integral foundational element for improving a modern healthcare system. One area in which the Affordable Care Act has frequently been criticized is that it didn't do anything on prevention and wellness. This charge is incorrect. As a matter of fact, the bill consciously tried to address within its provisions wellness and prevention. One area that was important was to reduce the financial barriers for patients using preventative services. For example, the Affordable Care Act, eliminated deductibles and copays for patients who are getting cancer screening tests or going in to get their cholesterol assessed or for other preventative measures. A second, probably more important measure relates to obesity. We recognize that people are just eating too much. So the bill requires restaurants with 20 or more locations, such as McDonald's or Red Lobster, to actually list calorie content on their menus or their menu boards, so that the public, when they buy, will know whether this sandwich has 1,000 calories or not. Now, many people thought, given past research, that this would not have that much impact on consumers, that they wouldn't look at the calorie content and then decide what to order, but that its big impact would be on manufacturers and restaurants. And rather than have a 1,000-calorie sandwich, they would shrink it down and offer smaller sandwiches or different kinds of sandwiches to consumers. There are other public health measures. For example, smokers can be charged 1.5 times more for their premium on the health insurance exchange. There's an incentive to health plans to offer wellness-related rewards, and more importantly, employers are given more latitude in offering wellness programs that incentivize their workers to lose weight, quit smoking, and begin exercising, keeping their blood pressure down, keeping their cholesterol down. I like to say that the Affordable Care Act was not the only way that the administration incentivized prevention and wellness. It has to be remembered that in February 2010, the First Lady rolled out her Let's Move initiative, which was targeted at reducing childhood obesity in a generation. This effort complemented the Affordable Care Act. It certainly changed the national conversation around obesity and made a lot of food manufacturers and producers really rethink how they were offering food. And in some ways, that Let's Move effort worked in tandem with the Affordable Care Act to try to emphasize and increase attention to prevention and wellness in society. We've just looked at a whole series of efforts in healthcare reform to increase the use of electronic health records, increase wellness. Next, we're going to look at a challenge that everyone is focused on, and that is, given all the new patients, how are we going to have the workforce to take care of them? The primary care doctors and the nurses.